Vamos a empezar nuestro live en el día de hoy. Vamos a ver en vivo. Perfecto. Vamos a empezar por aquí. Y vamos a hacernos. Martín, ven, no pude empezar ese, ayúdame, no pude. Me falta aquí ese Instagram. Perdóname un momentico que estoy en el proceso. Bueno, entonces vamos a empezar el live en el día de hoy y va a ser in English. Can you help me there, please, quickly? Okay, now. Thank you.
¿Dónde te metiste?
I don't know what I did. Now. Thank you. Okay, so we're going to talk today about facial rejuvenation and how to better approach it. That will be today's live. Okay, so we're going to talk, as I said, we're going to talk about facial rejuvenation and how to approach it the best way. And if we talk about facial rejuvenation, we need to talk first, and how to approach it, we need to talk first about how we age in the face. Because there are certain patterns that we can see in people, right? It doesn't mean that we have exactly the same way in every single human being, meaning the way we age. But yes, we can guide ourselves how we're aging and what we can improve with a facial rejuvenation procedure, surgical and non-surgical. Let's see if we can do all that today, or we just talk about how the face ages, and then in another live we can talk about how we can fix it. But let's see how it goes, okay? So the first thing when we're talking about the face and the aging process, remember that we have to see first the cover, right? The cover of the face, let's say the outside, meaning the skin, of course. And with time, with age, we start to accumulate the sunlight. And remember, it's not just the sunlight, it's the sunlight and the light of the TV and the light of the phone and the light of the tablet and of the light of my house. All of that light accumulates in my skin for years. And that's why many times we start to get dark spots on the face. Those dark spots are this accumulation of light and make like a more aged appearance. Also, the dark spots can be due to hormone changes, especially in women, that we call melasma, okay? But that will be another subject to treat, to talk with you another day. So today we're not going to talk about melasma itself. We're going to talk about the aging process and how we age. So again, the first thing, we'll see the outside. How does the skin look? So we'll start aging, we'll start accumulating the light that we have absorbed through years, and appears the dark spots. And also the skin starts to dehydrate with time. Why? Because in our skin, we have collagen, right? And this collagen, with time, naturally starts to decrease. And if we start to decrease collagen, our skin starts to wrinkle easier. Collagen is like a fiber in our skin that helps us with elasticity, okay? So if we start to lose collagen, we start to lose our skin appearance. And also, part of the collagen molecule is the hyaluronic acid, our natural hyaluronic acid. And this natural hyaluronic acid, guess what? It absorbs or keeps water in our skin. So the less collagen we have means the less hyaluronic acid that we naturally produce, meaning that we will have less water inside our skin, meaning we will have a more dehydrated skin. And if we have a dehydrated skin, that means that we have a skin that looks more aged. Okay? So again, the outside will be the dark spots because of light, and also a little bit of dehydration of my skin that make it look less bright. Okay? And of course, we start to get little wrinkles, small wrinkles. right? Why? Because with time, again, the skin starts to dehydrate, and we mimic all through all our years, right? We smile, right? We frown, and all of those things that make us wrinkle, right? All of the facial mimic that we do repeatedly year after year and after year make us wrinkles, right? And remember that at the beginning, the wrinkles are dynamic wrinkles, meaning that they only appear when we do the mimic. But when we are relaxed, for example, in front of the mirror, we do not see that dynamic wrinkles. We will see them when we see the wrinkles in front of the mirror without mimicking, without smiling or frowning, all that. If we see the wrinkles without facial expression, that means that they are not dynamic. They are static, so they will be treated differently, okay? So for this outside part, yeah, we could do several things, because many times we think that a facelift will help me with this external appearance. And actually it does not. The facelift will help me when things start to go down because of gravity, earth gravity force, right? Everything goes down. And with a facelift, we will put it back where it should be, right? But we're gonna talk about that a little bit later. So for now, we're talking about the external part. And the external part, what we can do, of course, dark spots, we can use a laser to help get those dark spots if they are if these dark spots are due to sun accumulation or light accumulation. Because if they are due to hormonal changes, melasma, there's another subject, as I told you, that we will not speak of that today. Also, all of these small wrinkles that we start to get, and the dehydration, the natural dehydration that we get because of the aging process, we can help it with plasma. It's a good thing. Plasma really helps our skin hydrate. And also, it can increase the production of collagen, which also will help us to have a decrease in the dehydration process of our skin. Also, of course, all of the creams that we put, the lotions for hydration, can also help us, of course, right? I don't like a lot the anti-wrinkle creams, because many of those anti-wrinkle creams can also have a little bit of a peeling, not the one that you do in the doctor's office, but like a little peeling, yeah, and that with time, if you don't protect correctly from the light or the sunlight, or any light, lamp, TV, phone, all that, actually those peeling creams can give you spots, dark spots too. So that's why you can use them, but you have to really take good care of your skin. Or if not, sometimes we get a cream on and we say, oh, this is beautiful, it gives me such a nice appearance, and then we start getting some spots. But many times we don't really relate them with the cream. So make sure and that doesn't happen to you. So, but hydration only, great. Well, nothing will happen with just hydration, nothing bad. Everything good about hydrating creams, okay? But again, so that will be the steps. And also we can start upgrading a little bit more on our treatment, because we can do a laser too to decrease the fine wrinkles, okay? So the laser for the fine wrinkles, the laser for the dark spots, and the plasma for hydration. And also we can do other devices, like for example, radio frequency devices, or one that I love very much, that is the focalized ultrasound, and that also can help us with small wrinkles and increase collagen production. The radio frequency also increases collagen production. So all of those can be used for the external part. But if we're talking about facial rejuvenation, many times we think about, okay, that's when everything starts going down, right? And when we see our face, we need to see, like, the face is divided in 3 portions: the upper third, the middle third, and the lower third. So the upper third will be the eyebrows, from the eyebrow starts up. The second third will be this area here until the subnasal or the lip, the mid third, and then the lower third. And this thirds age a little bit different, let's say. So the first thing that we start noticing when we age is that the eyebrows start to get a little bit lower. But again, this doesn't mean that everybody ages the same way. Many people can have low cheeks and have still good eyelids. But I'm just telling you the common way of aging, but that doesn't mean that everybody ages the same way. Remember that we are human beings and each human being is unique. And also the way you age is unique. That's why aesthetic plastic surgeons, we do not do molds. We do not do the same in each patient. We don't do exactly the same surgical plan to each patient. No. We need to listen to the patient, then examine it, and then after that, we will do the unique surgical plan for that specific patient, for that specific necessity that that patient has in that specific moment of his life, her life, okay? So again, the first thing that we start looking would be the upper third and how the eyebrows are located. So usually we can say that we have a lower eyelid when we touch this bone that is here. You see this bone, okay? The upper bone, we call the supraorbital rim. And if you touch the supraorbital rim and your eyebrows are above it, like in my case, they are above it, then you can say that you're okay. You don't need nothing in your eyebrows, okay? But usually that's the first thing that we start looking. The eyebrows are a little bit low, and we start to see a little bit of bags in my eyes, and we say, okay, I don't like this, and we start to seek how we can look better, how we can look less tired, how we can look more rejuvenated, okay? So if we have the eyelids low, of course, we can put a little bit of Botox. Yeah, we can do a little bit of focalized ultrasound, can help them. We can put a little bit of, of hyaluronic acid in the temporal area. That will lift a little bit the eyebrow. Or we can do an endoscopic brow lift with small incision here, small incision here, small incision here, small incision here, inside the hair so nobody notices them. Sometimes another one here. And with that, we'll lift a little bit the eyebrows so that we can have, again, a bright, let's say a bright expression, not a tired expression. Because the lower eyelids make us look a little bit tired, okay? For example, myself had an endoscopic brow lift several years ago, I think like 8 years ago, because that's the first sign that appeared in my face, a lower eyelid, okay? So, and then another thing, if we go from up to down, we can start looking that we have excess skin on the eyelid, right? And when we do have excess skin on the eyelid, then we can think on an upper blepharoplasty. But many times patients come to the office and say, I want my eyelids done. And when I do the exam, they don't really need the eyelids done. They haven't even looked at themselves and see that the eyebrows are going down. So the first thing that you should do is first lift the eyelid. Not lift it high, but just leave it where it is, a little bit higher than the rim, or at the rim, depending on the patient, but not lower, okay? Usually it should be at least 4 millimeters above the supraorbital rim, or this bone, so that the eyebrow is in a correct position. And when that happens, you're good. But many times we want to do a blepharoplasty without noticing that what we really need is to put our eyebrows where they should be, above this bone, above the supraorbital rim. And then many times we do not need to do the eyelids. We need to do an endoscopic brow lift. Or many times we have to do both, because some patients do have a lot of skin. And in those patients, we can do a blepharoplasty. But when I'm examining my patient for a blepharoplasty, if I see that they also have a lower eyelid, then I usually would suggest to reposition the eyebrow and also take the excess skin if the patient has that excess, okay? So if we keep on going lower, we will see the tear trough. In the tear trough, many times we can see just a depression, or sometimes we can see the bag eyes that we don't like because they make us look tired, of course. So if we have just a depression, we can just camouflage it with a little bit of hyaluronic acid. We put it in the depression, and that way it will look less noticeable. Or If it's dark, it would look less dark. I always tell my patients that you should not put too much here because then it will look bulky. It doesn't look nice. But a little bit is good. A little bit will camouflage the bags or camouflage the dark color. A little bit. But we should not aim to overcorrect it or to correct it, get rid of all the hollow. Because if you get rid of all the hollow, then it could look bulky afterwards. But yes, if you put a little bit here, it will, let's say, difuminate the dark color, okay? And then if we, and also with the hyaluronic acids, we can camouflage a small bag, a small eyebrow, a small eye bag. You can camouflage it with a little bit of hyaluronic acid too. But again, a little bit. If you put too much, it doesn't look nice, okay? The other thing that you can do is when you do have the bag there, like it's really noticeable, and then you can go ahead and think on a lower blepharoplasty. And usually if it's just a bag, we can do the incision under, in the eyelid, in the inside of the eyelid, so we will not have any scars outside. And that's just great, okay? Easy recovery, okay? So again, upper third. We need to see upper third, how it looks. Upper third, you look at the eyebrow, where it is positioned, and also you look at the wrinkles down here, okay? Many people think that if they do an endoscopic brow lift, they will get rid of all the wrinkles. And that actually is not true. The endoscopic eyebrow lift, the endoscopic brow lift will help me reposition my eyebrow above the supraorbital rim or this bone. But it will not get rid of these wrinkles, at least not permanently. Because yes, the endoscopic brow lift will help with the wrinkling, but guess what? You keep on doing the mimic, the facial mimic, because we cannot cut forever the muscle. Before, several years before, when the endoscopic brow lift was invented, we usually cut, for example, these muscles that are called the corrugators, and we cut them, absolutely. We even put fat between the two pieces of the muscle that we cut so that it never joined again. But guess what happened? When we do the endoscopic brow lift and we cut forever this muscle, the eyebrows start to get up. And meaning, for example, usually the head of the eyebrow should be a little bit lower than the tail of the eyebrow, especially if you're a woman. And with the endoscopic brow lift, they started to go up and separate themselves, like the eyebrows that the clown paint on themselves, and they didn't look nice. So that's why we stopped doing that, okay? The other thing, so again, the endoscopic brow lift will help you reposition the eyebrow and will help a little bit with the wrinkles, but they will come again eventually because you will not cut forever the muscle. You just decrease the power of the muscle. But with time, since you always do mimic, because that's what we do when we talk, we express ourselves, the muscle will start to get, let's say, conditioned again, and then the wrinkles will appear again, okay? So the other thing will be the eyebrows, sorry, the eyelids. If you think you're a good candidate for a eyelid surgery or blepharoplasty, always have a look at your eyebrows to see if you do both, or many times you just need to do the eyebrows and don't do the eyelids, or many times you just do the eyelids and don't do the eyebrows. For example, in my case, as I told you, I did first the eyebrows and then repositioning them, and then 8 years after, I did the blepharoplasty because I had enough skin to cut. And how do you know that you have enough skin to cut? I always tell my patients to have a look at themselves in the mirror at the same level, not up, not down, at the same level. And if you see their skin that is like really near or in your eyelashes, that means that you have excess skin and you're ready for a blepharoplasty. But when you look at yourself, this distance, the same level, and there is not skin, that is extra skin that is coming down to the eyelashes, you don't need a blepharoplasty, right? So just, that's how you should approach the possibility of a surgery or not, okay? Then if we start going down, we start to, let's say, to lose the tightness of my skin, and because of the gravity force of planet Earth, everything is pulled downwards. So my cheeks are pulled downwards. So we start to see this indentation here, the nasogenital, the, the, the natural groove that is done here, because the cheek starts to come down, of course. And then we start to lose this mandible, right? The mandible angle and this like straight mandible look, we start to lose it because everything goes down, and a thing that is called the prejowl starts to appear here, and that makes us look oh, and that starts to give us an expression of sadness, because usually the angle of our mouth starts to go down, and that really makes us look sad. So again, bags or extra skin or a low eyebrow make us have a less crisp appearance on my eyebrows, on my eyelids. Less crisp, like tired. And when the cheek starts to go down and my angle of my mouth starts to go down and I start to get also lines here, right? Then I look sad. And how do I get rid of all that sadness? Again, I can reposition the cheek that is falling down so that it looks less evident, the action of the planet Earth force gravity. And how can I reposition this one? So I can use non-surgical options, such as, for example, I can use a little bit of hyaluronic acid, which I love. And what we do is we put a little bit of product under the muscle tendon. And guess what is the muscle tendon? There's the muscle, and then at the end is a tendon. The tendon inserts or gets in, let's say, the bone. So what we do today with hyaluronic acid is that we put a little bit of hyaluronic acid under the tendon, so the tendon shortens a little bit, and the muscle, the natural muscle of yourself, pulls up. It's a pretty amazing procedure. Of course, it's not a facelift, right? But done in the right hands, it looks really nice. I love the face of, for example, residents, the plastic surgeon that is, the doctor that is studying to be a plastic surgeon. And when they see you inject a patient for the first time, I, for example, right now have a plastic surgeon. She's already a plastic surgeon. She's doing an aesthetic fellowship with the International Society of Aesthetic Plastic Surgery, and they come for 3 months at the surgery center. And the first time she saw injecting me the hyaluronic acid under the tendon of the zygomatic major, that is a muscle that comes here. And she saw also putting a little bit of product of hyaluronic acid under the temporal muscle to lift the eyebrow and lift this area. When she was looking at what I was doing, I was working on the patient, she was like, wow. You could see her face like, wow. And the funny thing that I was treating a patient that is a patient that I've been treating for several years. So she knew what happened, because usually I do one part of the face of the patient, and then I tell them to look at themselves with the mirror so that they can compare, and then I do the other part so that you can really see the difference. So she had already been before with me several times, so she knew the difference. She didn't have the mirror in herself, but she told, when she saw the resident's face, she said, oh yes, magic, and I love it. That's what she told the resident. So yeah, it's like magic, like I say. In the right hand, it looks really nice. So, but again, if you have a lot, it will not be enough. If you have a lot, you have to go for a surgery, of course. But before that, there's also a machine that I love. We have it at the office too, and it's called a focalized ultrasound. And what we do with that machine is we tighten a little bit too. And I love that. So if you have a little bit of looseness, the combination of both the machine and the hyaluronic acid are great, okay? And of course, for the dynamic wrinkles, those that appear when you do the facial expression, Botox will be a great option. Or we can do a little bit of a laser resurfacing to try and get rid of those little fine wrinkles, okay? And again, if we have a lot of looseness, what do we need? A surgery, of course, a facelift, yes. Many people are afraid of that, like, oh no, I will look like a mummy. I will look like, how people say. There was this patient that told me, oh doctor, please, I'm gonna have a facelift, but please, 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 don't let me look like a frozen fish. Yeah, so usually what we do with a facelift, we reposition the muscles that have been going down because of the gravity force of Earth gravity force. And of course, if we look at the facelifts several years ago, usually the tightening of the muscles, the reposition of the muscle was done from the front to the back. So it looks pretty unnatural actually, because you don't age like that, no? You are not like here and then age like to the forward. No, you don't age forward. Gravity force doesn't move your skin and muscle forward. No. I wonder why we were pulling back instead of up, because gravity force push everything down. So when we do a facelift, we should pull up so that you have what? A natural look, and it's still you, but look less aged, of course, right? And that's it. And of course, many times we have to also do the neck, right? So that we can really, really, really achieve a good defined mandible line that is desirable and that gives you, let's say, a more younger face. So that's what we do when we do a facelift, okay? Of course, we do have some incisions. I always tell my patients, if you want little results, you will have little incisions. But if you really want a good result, we will have an incision. But don't be afraid of it. Usually the upper part is inside your hair, so nobody will notice it. There will be a part of the incision that is in front of your ear. But usually, haven't you noticed that we also, when we age, we have like a little wrinkle here? So the scar is in that wrinkle. So it's really, really, really very well camouflaged. At the beginning, it can look a little bit red, pink, but with weeks, it heals very well. And then on the posterior part of your ear, you can also have a scar. And it will depend on how much skin or extra skin you have, how long the incision will be behind the ear. And also we can have one here, depending on how much excess skin do we have. Because remember, every patient ages differently and at a different pace. So that's why every surgical plan is unique for that specific patient and for the needs of that specific patient. Many times we have a patient that really needs a surgery, a facelift, but they are just not ready for it. Okay, so I can offer them the non-surgical options, right? And that will improve a little bit, but if they have a lot of loose skin, well, eventually it will be better to do that facelift. So for those that don't live in Colombia, if we do the non-surgicals, usually if we do the ultrasound, the focalized ultrasound will be just one treatment. And the hyaluronic acid will be just one treatment. We can do even in one day, we can do everything. The focalized ultrasound, the hyaluronic acid, the Botox, and the plasma. The whole package, as I say, can be done. Of course, you need to remember that is non-surgical option. So it will improve and you can actually see it. That's why, again, I show you when I'm doing one side of the face, and then show you the neck, the side that is not treated, so that you can really, in that moment, see the difference. But if you do have more, then it is advisable to have a facelift. And for the facelift, for those that don't live here in Colombia, in Cali, it's important that I would love if you could stay for 3 weeks. If that's too much, 2 weeks, but not less than 2 weeks for a facelift. I always say that it's very important, the post-op follow-up. So if you try to do a surgery and just leave the country 3 days after, it's not the best. At least not for a facelift. For example, if we're talking about hair transplant surgery with the FUE technique, of course, you can leave after 3 days, no problem. But for a facelift, I like to follow up more with you. So usually you'll have some exams We will do the procedure, and after the procedure, we leave you one night, overnight, in our surgical facility. And you will end up after the procedure with a big bandage that actually doesn't look very nice. But don't worry, next day we will take that bandage out, and usually we will take the drain that is like a hose that goes back here. That actually is not nice, but we have to leave it so that at night, if you produce any liquid or seroma that we call, it can go out through the tube, and then it doesn't accumulate inside you. So after that, we take the tubes out. Next day, we take that not nice bandage, and then we put you a tight garment here. That tight garment, I want you to use it for 10 or ideally 15 days for the day and night. And then after that 10 or 15 days, you will use it until you have 1 month of post-op time. But just when you're at home and nobody's looking at you, okay? Until you complete 1 month. So every day, 10 days, or if you can, 5 more days, 15 days every day. And then after that, you will just put it when you're at home and nobody is watching you and looking at you to complete 1 whole month. No heavy exercising for 1 month. That's something that I forgot to tell you. With the non-surgicals, actually there's no downtime. You can do whatever you want whenever you're ready. But you can get bruises. For example, myself, I had hyaluronic acid and a focalized ultrasound the week before, and I ended up with a bruise that is still there. Unfortunately, I did it last Thursday, and I have a little bit of a bruise still. Yeah, my skin is white, and I bruise easily, unfortunately. So that can happen. So you know that it's a possibility. But usually I take my time and try as much so that you don't bruise, but it can happen. A bruise can happen with the non-surgicals, but again, no downtime. So if we are talking about the facelift, the surgical procedure, the facelift, yes, we do have downtime, as I told you. 1 night, you stay at the hospital, 10 to 15 days with the tight garment, and day and night, and then just at night for another 15 days until you're 1 month post-op. If there are bruises, no light, no sun, because the bruises, when they get light or sun, they can end up being a dark spot, and they are not nice. And no heavy lifting, no exercising for 1 month. That will be stitches. If we do the endoscopic brow lift, we will have some stitches inside the hair. And those stitches will go away after 10 to 15 days, maximum 3 weeks, maximum. Stitches here will go away more or less 8 days afterwards. Stitches here and back here or here, again, 15 days or maximum 3 weeks. That's it. When you take the stitches out, there will be a little bit of redness in the scar, but that redness will go eventually. Many times it goes very easy in this area here, but can stay a little bit longer, the redness, in the back area of the ear, because there's more tension on the incision. And an incision with tension is more prone to be immature for a longer time. Immature meaning that it's red and a little bit bulky can be. When you have a scar that is a little bit red and bulky, usually it is a scar that is immature. Once the color of the scar turns from red to white, then we can say that the scar has matured and there will be no big change in it. But while the scar is red, a little bit bulky, usually it means it's immature and it will improve. You just have to give them time, of course. Well, I think that's what I had to talk to you about, how to approach the facial rejuvenation and all those things that we can do to improve it. So I'm gonna look for some questions before we end up our live today. So let's see if we have some questions, or if you're shy. Many times you're so shy and you don't ask questions. Let me see if we have any questions. Okay, let me see. Actually, no questions. Wow. Okay, so if we have no questions, I guess that we're finishing our live today. So thank you very much, all of you, for being in these lives. As you know, we do have these lives in English once a month, more or less. But in my channel, you can watch also a lot of more of these videos in Spanish. So just have a nice rest tonight, and I hope to see you soon in another live. And don't forget to write in the social media to see if we have any theme or subject, specific subject that you want me to talk in our next live, in our next English spoken live. Also, we have one question. Thank you, Shavella. How soon you can travel, flight back after surgery? Is 3 weeks okay? Yeah, 3 weeks will be okay. Yes, more than enough. Usually 2 weeks, it's a little bit short, but some people do it after 2 weeks. But if you have 3 weeks, it will be perfect. That's what I like. That will be the time that I prefer, 3 weeks. So now, thank you very much again, all of you, and I hope to see you soon in my next life. Bye-bye. Have a good night rest.